There are many factors that influence the health of Indigenous Australians. In this video, we will discuss the social and individual determinants that affect the health of the Indigenous population in Australia, and discuss the reasons why there is a discrepancy between the health status of Indigenous and non-Indigenous Australians. Health issues exist in Aboriginal communities because of biological, social, cultural, economic, and environmental factors.
One factor that influences Indigenous health is socio-economic status, SES, which is comprised of three factors, which are employment, education, and income. In 2013, Osborne, Foam and Brown, in their Australian Institute of Health and Welfare report, AIHW, stated that Indigenous Australians have a lower socio-economic status than non-Indigenous Australians, which is evident as the Indigenous Australian population is overrepresented as recipients of welfare benefits. The Australian Health Ministers Advisory Council, AHMAC, found that lower incomes contribute to higher levels of health risk factors such as smoking, physical inactivity, poor diet and substance abuse, inevitably leading to poorer health outcomes.
Education is associated with higher socio-economic status and improved health outcomes. People who have access to education and have higher health and literacy rates are more likely to have better health as they get older. According to the Australian School Statistic 2009, Indigenous Australians have lower educational results as non-Indigenous Australians. 45.4% of Indigenous people who started Year 7 finished Year 12, compared to 77.3% of non-Indigenous people.
Another vital factor that influences Indigenous Australian health is their biological makeup, especially when dealing with non-communicable diseases. McDermott in 1998 states that previous research has indicated that type 2 diabetes is more common in ethnic groups like the Australian Aborigines, which has contributed to a modern world epidemic.
O'Sullivan in 2012 recognised the relationship between Indigenous culture and health outcomes. He contended that Australia needs to promote cultural respect through public hospitals to seek to prevent the high incidence of premature and preventable deaths of Indigenous Australians compared to non-Indigenous Australians. Additionally, there has been a significant burden of history, i.e. the stolen generation, acting as the original source of injustice among Aboriginal communities, embedding a long-term injustice between Indigenous and non-Indigenous communities in Australia.
Considering all aspects of current literature, there are a number of different views on the aspects that influence Indigenous health. In terms of income, both the AIHW and AHMAC find that low levels of income leads to poor health outcomes such as shorter life expectancy, poor education, substance abuse, crime and violence, and reduced social participation. In 2012, AHMAC supported this association between income and health as 62% of Indigenous people who were in the lowest household income quintile self-assessed their health as fair or poor. Education outcomes, which is found to lead to poorer health, fewer opportunities, low incomes and lower employment. AHMAC recorded a study conducted in 2011 which found of the Indigenous students in Year 7, 77% met the minimum standard for reading, 67% for writing, and 77% for numeracy in the National Assessment Program Literacy and Numeracy, NAPLAN. AIHW and AHMAC contend that employment is necessary to maintain health by ensuring goods and services which promote health can be accessed. In 2013, the AIHW report found that labour force participation rate of Indigenous Australians is 58%, whereas for non-Indigenous Australians the rate is 77%. Similarly, the 2012 AHMAC report found that between 2001 and 2008, Indigenous unemployment increased from 7% to 11%. These statistics indicate low employment for Indigenous Australians, which leads to poorer health outcomes due to reduced income.
With reference to biological factors, the AIHW in 2004 supports McDermott's statement reporting that there is a higher rate of type 2 diabetes diagnosis in Indigenous Australians when compared to non-Indigenous Australians. This is due to biological, behavioural and environmental factors. In 2015, Diabetes Australia contended that although type 2 diabetes is a predisposed genetic disease, the risk of development is affected by lifestyle choices like diet and levels of physical activity. According to AIHW, Indigenous Australians that live in remote and rural areas are twice as likely to report having diabetes than those from non-remote areas. Indigenous people living in remote areas may have difficulty accessing fish, fruit and vegetables and may rely on processed foods, which are often higher in fat, salt and sugar, which can increase the risk of overweight and obesity, cardiovascular disease and type 2 diabetes. Furthermore, it is more difficult for those living in rural areas to access healthcare centres to acquire treatment and management of their health.
From a cultural perspective, Napier et al. In 2014 similarly address O'Sullivan's view that Australia's healthcare system should be made more culturally sensitive to Indigenous Australians. He states that the health of Indigenous Australians ought to be promoted immediately, specifying several areas that have a significant effect on Indigenous health and well-being. Some of these areas included the accommodation of medicine that is culturally appropriate, the building of trust within healthcare services, and for healthcare providers to develop new models of well-being to become identifiable and supported across both Indigenous and non-Indigenous communities. However, he also suggests a contrasting argument that culture can act as a barrier to improving health status among Indigenous Australians. The connection between culture and health outcomes is also supported through Dockery's article in 2010, which included a 2002 National Aboriginal and Torres Strait Islander Social Survey, also referred to as NATSIS. It compared various factors measuring Indigenous culture and implies the loss of a cultural connection, particularly in major city populations, that could ultimately affect Indigenous Australian health. One of the main indicators being the main language spoken at home, the highest being English at 80.9%. Additionally, the survey displayed there are more Indigenous Australians living in remote areas of Australia, possessing a higher cultural attachment but a decreased access to health services due to their geographical location, thus affecting their socio-economic status. Therefore, the desire for a better cultural connection to their homeland, Indigenous Australians are not receiving the same benefits of health services as non-Indigenous Australians, and, as stated by both authors, healthcare providers need to recognise this significance to improve the health and well-being among Indigenous communities.
Up until only recently, there's been a lack of success improving the mental health and emotional well-being of Aboriginal people. There are a number of reasons for this. Previously, programs were structured as a one-size-fits-all approach. Hunt, in 2013, argued there was a lack of government funding, poor management of expectations, and lack of engagement with community-based organisations. In 2009, Riebel and Walker discussed the fundamental lack of access to mental health services for Aboriginal people in both rural and urban locations, and this is due to the services being culturally inappropriate. Dudgeon of 2012 stated for a program to be effective, there must be community engagement. In 2004, 9 principles were outlined by Swan and Raphael in the National Strategic Framework for Aboriginal and Torres Strait Islander people's mental health and social and emotional well-being. These are health as holistic, the right to self-determination and control, the need for cultural understanding, the impact of history in trauma and loss, recognition of human rights, the impact of racism and stigma, recognition of the centrality of kinship, recognition of cultural diversity, and recognition of Indigenous strengths. Specifically, in 2013, Atkinson stated that there's been a transgenerational trauma and grief and loss due to the forced separation of children from parents. So when these 9 principles are utilised together, the collection of principles takes on that holistic approach to health.
As discussed, there are many factors that influence the health status of Indigenous Australians. However, all these factors are interdependent with each other, meaning that they are all connected and influenced by one another. For example, Indigenous Australians are 3.3 times as likely as non-Indigenous Australians to report having diabetes. Although this is a genetic determinant, it is also affected by behavioural problems like unhealthy diet and low levels of physical activity. Furthermore, low SES may prohibit some individuals from accessing nutritious foods, as these may be more expensive and less accessible than foods higher in saturated fat, sodium, and sugar, which in turn can contribute to diabetes.
These factors also contribute to the difference in life expectancy between Indigenous and non-Indigenous Australians. In 2014, the AIHW found that for Aboriginal and Torres Strait Islander populations born in 2010 to 2012, life expectancy was estimated to be 10.6 years lower than that of the non-Indigenous populations for males and 9.5 years for females. This is due to circumstances in which most Indigenous Australians live, that is, food insecurity, geographical location of resources, high levels of behavioural risk factors, e.g. smoking, alcoholism, low socioeconomic status, and prevalence of mental health.
A lack of understanding of Indigenous culture can act as a barrier to mental health in remote, rural, and even metropolitan locations. The traditional method of treating mental health must change if we are to have any chance of bridging the gap between Indigenous and non-Indigenous mental health.
In conclusion, there are many determinants that affect Indigenous health. In order to improve the health status of Indigenous Australians, these factors all need to be recognised and addressed by the Australian government and community as they interrelate. There is still a long way to go to improve the healthcare of Indigenous Australians and to bridge the gap until health equality is reached.
In order to improve health outcomes for Indigenous Australians, a series of measures and programs should be put in place. The aim in the near future is to gather credible information taking into account the small and dispersed population of Indigenous Australians when referring to health statistics.
One measure that should be taken is to improve access to mental health providers with a mentoring approach, which will produce a greater outcome for the mental health of Indigenous Australians in the long run.
Our final recommendation is to improve primary and secondary enrolment, as education is a key determinant of health. Individuals with higher education are more likely to be exposed to health information which can improve their community's health.